Hello, my name is Lola from Outriders, and this interview is a new COVID talk where we are talking to people from around the world about local responses to the effects of COVID 19. Today, we have a very special guest. We have the honor to have with us the Minister of Education of Sierra Leone, Dr. David Moinina Sengeh, who will tell us about his channel on YouTube to inform the population about the pandemic in Krio language. We will ask him also about the lessons from another epidemic that they suffered recently. As you know, Sierra Leone, together with Guinea and Liberia, was one of the three hardest countries by the Ebola outbreak in 2014. And in Sierra Leone, they are making the most to their experience and facilities to combat this pandemic. Good morning, Dr. David Moinina Sengeh. Okay, well, firstly, thank you so much for attending this interview with Outriders. And as I told you by email, we are creating a big database with positive responses to the effects of COVID-19. And well, we would like to ask you to tell us a little bit more about this channel on YouTube that as a minister, but also as a YouTuber, you have created to teach to the population about difficult topics in a language for everybody. So we would like that you explain us a little bit about you, about your mission, about this channel.
Thank you very much. My background is a little mix of many things, but currently I'm the Minister for Basic and Senior Secondary Education and the Chief Innovation Officer. And I also make music and do in the creative space. And so when COVID happened, I observed that a major difference was because it's quite technical. There are lots of technical reasons behind policy decisions, and people don't necessarily get to understand why, as policymakers, we make certain decisions. And the reason is because they don't generally understand the science. And so I started Moi Minute, where I discuss the basic fundamental science behind specific policy decisions and around COVID in general. So an example is, how do I explain why I use a face mask in Krio? Or what is a virus after all? What does quarantine mean, or isolation? What is it? What is epidemiological data? Right? These are all big words, but actually they can be simplified and understood. And if people understand the concept behind decisions, then they're more likely to support.
How many episodes did you create so far? Sorry, I don't know if you can hear me. Okay, yeah.
I missed your question.
Yeah, sorry. How many episodes did you create so far since the pandemic started and you launched this channel? How many episodes? How many videos did you create?
I think maybe I've created about 6 videos.
Okay. And how is the current situation in the country? Because I read that you recorded 0 cases for 1 month, so it's quite well. How is the current situation right now? There are people are under lockdown, or sorry, I don't know. Can you hear me fine now? Sorry, can you hear my question?
Sorry, can you repeat the question?
Yeah, yes, I don't know why I missed it. Okay. No, I would like to know the current situation in the country right now, because I read that there are 0 cases of COVID-19 for 1 month. So how is the situation right now? There is lockdown, people are already going to the office.
We still go to the office. People still go to the office, and it's the cases are rising, but they're manageable. Many of the cases come from quarantine. They are known contacts, so we have an epidemiological link for those cases. There is community transmission, so we need to keep engaging people so that they understand the risks that are there. But many of our cases, including from our increased testing, are ones that we're aware of.
And could you explain another measures that were implemented in the country to mitigate the effects of COVID-19? Because you said that. Sorry.
Yeah, so we've had a couple of different things. One, we've had lockdowns nationwide, no movement. We currently have an inter-district restriction, so partial lockdown where people don't travel across districts. We had very early on rigorous testing at borders, and we had quarantining measures. We closed schools, and maybe on the day we had case one, we closed schools and institutions, and we banned congregations, lots of people. So we put in a lot of measures that are around social distancing and around preventing people from gathering in large places.
What are the main challenges right now regarding the pandemic?
Main challenges?
Yeah.
I think it's the connection with people, like people understanding that actually the best thing to do is to protect your family and to protect your neighbor. And if we think about how we communicate that COVID and we will break the chain is by you not infecting other people. And so the minute you feel like you've been exposed, the minute you feel like you have symptoms, you need to call emergency, you need to self-isolate, you need to make sure that you communicate effectively with everyone. You don't put other people at risk. I think the biggest global challenge is how we communicate this fundamental message that the chain is only broken when whether you have it or you think you have it or you have symptoms, limit how many people you expose.
And was there any lessons from the Ebola outbreak that you learned that you are applying today with this crisis?
A lot of the things that we're doing in Sierra Leone is informed by our experiences from Ebola and just our robust planning. So we have a One Health policy, which is really talking about the link between animal, man, and health, and the link between different ministries, departments, and agencies in health, the link between local and international and community transmission, and with social mobilization strategies. And that was developed just last year. We have an integrated district health information system that we've been using that was developed again over the last couple of years, but post Ebola. And a lot of the emergency operations center modules we brought in from the Ebola period in terms of saying that Ministry of Education, a lot of our work, including the online radio, is also from Ebola. So there are lots of different things that we're doing. Our surveillance mechanisms, our contact tracing mechanisms, our messaging and social mobilization, our ways of prevention and hygiene at the home, including the facilities as well that we're using. We borrowed from our experiences during Ebola.
And I read a lot of things about innovation and your background working in different initiatives, but I would like to ask you about innovation in Sierra Leone and if there is any response to COVID-19, I don't know, created by startups or by innovators doing tools, or would you tell us?
Yeah, there's lots of local innovation, and that's parts of the the system for entrepreneurship and startups is growing. And there are a couple. One is a young man who developed a automated hand washing station, no touch, where you don't interact with it, and he put it all together, and he had it by the law, by the high court, and lots of people go to the courts and in that interaction. We have startups who are using drones to monitor compliance during lockdown. We have startups who build USSD SMS apps for information updates and for self-assessment. We have startups who build platforms for getting passes during lockdown. So the passes are automated. How you apply for it, how you check for it is mobile-based. We have a research from the university that made a local ventilator using the inner tire from a car tire, the inner tube, and they're now just about to develop that. There's been a lot of really wonderful activity that's happening locally.
I read something that you said, I don't know if in a TED talk, because as you mentioned before becoming minister, you have a background in science. You studied in Harvard University. You created a red NGO to change the idea in Sierra Leone of aid to Africa to made in Africa. And I would like to ask you if today, maybe because with the crisis and all this initiative that you told me, if we can learn more about this, because usually media publish about bad things, but they forget a lot about these positive things. Do you think this is the moment of this made in Africa?
I mean, I think it's the moment where everybody has to look internally, and they say creativity usually comes from a place where you really have where you push the wall. And globally, we can see that everybody has to innovate, everybody has to create. There's no, we all have to contribute, and that's part of this. The world, all of us have the same problem at the same time, and so we all have to contribute our own part. And so it's this idea of local innovation and learning to making to learn. As you said, it's over a decade old. We've been working on this and going with young people, and so there's a culture already of young people trying to problem solve, and it's easy to tap into that culture, and that's what we're doing.
Thank you. Before finishing, I would like to ask you about a picture, because we talk about YouTube, but also there was a picture that you posted on Twitter, and it went viral, and you were with your daughter, and I would like to ask you, why do you think this picture was so famous around the world? A father walking with her daughter.
I don't know. I mean, I think there are multiple things that happened in that photo. People don't consider leaders, ministers to be young people who, I don't know, who wear dreadlocks. That's one. And so there's that fascination. People don't consider young people as well, kind of males, being active partners in their children's lives, and how people connect. And the idea of connecting on Zoom, everybody also has been sharing about how you connect on Zoom so people can relate. But I think the surprise really is that, and which is what the leading BBC article was saying, is women do this all the time. Women do this all the time, that we've normalized it. So it was almost different. And I don't do this every day, right? I go to work. When I go to work, then I'm not at home. And it's that, it's almost like it forces everybody to pause and reflect, whether you're a man or a woman, on the assumptions that we make, the things we take for granted, those people who we don't see in all its shapes and forms.
Did you expect such a reaction, or you did it because you thought, okay, it's my normal day?
It's normal. It's just normal, authentic. There was no, and I was saying, like on my personal Facebook, I've shared multiple photos of me carrying my baby on my back, so it's not like it was the first time. And my kids, like it's a normal thing. But the internet is the internet. It runs away with certain things. It's normal to do, but it also is not my everyday.
Yes, I don't know if you would like to add something that I didn't ask, or something that you would like to say about Sierra Leone that we should know before finishing this interview.
I mean, I think one of the things that that is wonderful about Sierra Leone is our preparedness and the connection and our resilience. And people talk about resilience, but really it's a resilience that comes from creativity and innovation and problem solving across the board. And we're hoping that we can continue to manage the crisis, and as the cases grow, we can effectively still ensure that people are getting treatment and are getting out, and our health system is not overwhelmed. But it's such a beautiful space to be in, where we can all look internally and begin to apply ourselves to solve the problems and contribute globally.
Okay, thank you so much, Dr. Moinina. Thank you for being today with us, for sharing this beautiful experience.
Thank you.
Thank you. Thank you so much.
Bye.